My name is Dr. Sheryl Brown. I am a family practice doctor here in Latham Medical Group. I am so heartbroken about what our country is going through and all of the lives that have been lost. The coronavirus, unfortunately, has disproportionately affected the communities of color. And this is something that highlights some of the systemic failures in the healthcare system. Our goal as a community should be prevention. I would like to review some of the CDC safety information to help keep everyone safe. As you know, it is very easy to start relaxing some of the precautions because of what I call coronavirus overload. The weather is getting warmer and we feel it's okay to not stick to the precautions. I would like to remind everyone to please continue to practice social distancing, staying 6 feet away from others. Anyone over the age of 2 should wear a mask in public spaces. Continue regular hand washing. That's washing your hands for 20 seconds. So that's 2 happy birthday songs or 1 ABC song. Don't touch your face or mask with unwashed hands. These are really great ways to limit your risk for getting the coronavirus. Now, reducing your risk at home is a little bit more tricky. So I would like to discuss some of the useful precautions to practice at home. If you live in a home with multiple generations, so from the very young to the very elderly population, it can be tricky to keep sick individuals separated. So if you are sick or someone in your home is sick with coronavirus, these are important things to practice, especially in shared spaces. So if you share a bathroom with someone who is currently ill with coronavirus, that person who is ill or sick with the coronavirus should clean and disinfect after each use. So it is important that we allow the person who is ill to clean the bathroom to prevent infecting ourselves. If that is not possible, if the individual is too ill to clean and disinfect, you should wait as long as possible before you disinfect. At least 2 hours if possible. If not, use a glove to disinfect the areas that's used by anyone who is ill. Clean and disinfect frequently touched surfaces daily. These include tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. Laundry. So for clothing, towels, linens, and other things, launder items according to the manufacturer's instructions, but use the warmest appropriate water, if possible, and dry the items completely. Wear disposable gloves when handling dirty laundry, especially for individuals who are sick. Dirty laundry from a person who is sick can be washed with other people's items. Do not shake dirty laundry, especially for individuals who are sick with the coronavirus. Clean and disinfect clothing hampers according to the guidance I discussed earlier. Remove gloves and wash your hands right away after doing laundry, especially for individuals who are sick with the coronavirus. Individuals who are sick should be isolating, and this means they stay in a separate room if possible. The person who is sick should eat or be fed in their room if possible. Wash dishes and the utensils using gloves and hot water. Handle any used dishes, cups, glasses, or silverware with gloves. So wash them with soap and hot water or in the dishwasher. Clean your hands after taking off gloves or handling used items. The trash should be separate also. So anyone who is in isolation should have a dedicated lined trash can. If possible, a dedicated lined trash can should be in the room with the sick individual. Use gloves when removing garbage bags and handling and disposing of trash. Wash your hands afterwards. If you are a household member that works outside the home, wearing a mask when you are around vulnerable family members and maintaining safe distance can reduce their risk for contracting coronavirus. Keep clothing and shoes worn outside in a limited area of the home. Consider becoming a shoe-free home. Change your clothes and wash your hands before interacting with family members, especially if you are someone who takes public transportation or if you are working in an environment where you are not able to practice social distance safely. The CDC also recommends wearing a face mask when in public settings. Face masks can be a scarf, any cloth material to cover your nose and mouth. Do not touch your face with unwashed hands. After grocery shopping, wash produce with soap and water. Watching out for the symptoms of coronavirus. People with coronavirus have a wide range of symptoms, ranging from mild symptoms to severe symptoms. So symptoms may appear 2 to 14 days after exposure to the virus. People with these symptoms may have coronavirus. The symptoms include cough, shortness of breath or difficulty breathing, or at least 2 of these other symptoms: fever, chills, repeated shaking and chills, muscle pain, headaches, sore throat, new loss of taste or smell. Children have similar symptoms to adults and generally have a milder disease. When to call your doctor? If you develop any of these symptoms, do not wait to call your healthcare provider. Home remedies are not always the most helpful options during these times. We are here to help and answer questions, especially if you are hearing conflicting information. Our goal is, and always will be, providing the most up-to-date, evidence-based medical care to our patients. Stay healthy and stay safe.